Hi, my name is Amanda, and this is my Value of Occupational Therapy video. And I'd like you to meet my friend Amita McGarvey.
Hi.
And me and Amita know each other from even middle school.
Yeah. We go way back.
Yeah. So we went to middle school together, high school, and we also went to
college
together.
Yeah. And we live down the road from each other, and
Yeah.
we run together.
Yes.
Best friends.
Yes, we are good friends. So Amita, what do you do?
I work at the CDC in the NIOSH division, which is the National Institute of Occupational Safety and Health. And I work on the InfoSec team, the IT security team, and I'm the technical writer on my team.
Cool.
So I just work on different security systems at the CDC that are being put into place.
Very nice. And tell us a little bit about you.
I am 23, and I'm very close with my family and my friends, and I like to run a lot. I like to cook and eat a lot, and just work, really.
Awesome. Very good. So, Amita, what do you know about occupational therapy?
I guess when I think about occupational therapy, I think about maybe OT and PT, physical therapy going together, and I think about OT being more of the fine motor skills, everyday skills that people need help getting back those after, I guess, an injury or maybe some disease or chronic problem.
Yeah.
And I guess it's for all age groups too.
Right.
And I don't know, I guess when I think PT, I think more sports related. OT could be more general. So
You've got a very good grasp on it. So you know PT as you went growing up to a physical therapist, and occupational therapist is very similar to what you were saying.
Right.
And what do you think the difference is between OT and PT? You touched on it in what you just said.
Yeah, well, PT I grew up going because I did competitive gymnastics, so I was always having injuries, but those injuries weren't severe enough that they inhibited me from doing everyday tasks, but I just needed the specific therapy for sports.
Yeah.
So I guess that's what I think the difference is occupational therapy is standing up out of a chair, sitting down, maybe brushing your teeth, stuff like that.
Yeah.
Very good. The main difference.
Yeah. So the way we learn the differences between it is that physical therapy, they teach you how to walk again and how to do things like mobility-wise, and then occupational therapy, they take a holistic approach, and they look at you and they see what you like to do, what you want to do, what your condition may limit you from doing, or what your environment might limit you from doing, and they take a whole assessment about where you are and what problems you're facing, whether it's because of your injury, like you've got a physical problem, or if your environment, or if you just grew up with a genetic disorder. But they take a holistic look at you, and they think about what you want to do, and they try to help you get to that path.
Okay.
Yeah.
I see.
Yeah.
And how long does it normally take for a patient to recover with occupational therapy?
It varies. Yeah. So you could be a pediatric therapist, and you could work with kids for multiple years, just depending on what they need to work on. And if you're in an inpatient setting, like in a hospital, then you might be working with your patient for 2 to 5 days, or just depending on how long the patient is there.
I see.
Yeah. And if you work in a school, then you might see the same kid for a year for 2 to 3 times a week, or that would be on a good a good therapist to student ratio kind of thing.
Is it normally more of a group setting or more just one-on-one?
It's normally one-on-one, but they do have group settings.
Okay. So I feel like it'd be better if it was one-on-one, maybe.
Yeah. Yep. So the therapist normally just meets with the patient, and depending on if the family's involved or not, like if in certain cultures the family can be really involved with the person, and instead of it just being the person's decision, they consult with their family, and they all talk together about what to do.
I see.
Yeah.
Okay.
And so what kinds of settings do you expect to see an occupational therapist in?
I guess, like you said, hospital or maybe their own practice clinic, or also if you go to people's houses, I would assume.
Yeah, so that's called home health.
Home health. I think of that.
Yeah.
Those are the main ones.
And you could see them in nursing homes or rehabilitation homes.
Right.
Yeah, or schools. And they're also doing something called telehealth. Or
they talk you through on the phone? How to do it? That's
or if you live in a rural place and you don't have access to one in person, then you would be able to have that. And they could work in communities, like how you were saying with group things, like they might work with people in a community setting.
I feel like they would need at least a caretaker or someone to maybe assist with.
I guess it depends on how
severe their problem is.
Right. They have therapy programs called intensive things, so one person might receive therapy for 3 to 6 hours a day.
Oh, wow.
For a week, maybe
That's
2
very
weeks.
Intense.
Yeah, so it's supposed to be effective. They're doing more research on it, but yeah. And what kinds of populations do you think they might work with?
Probably just varies. I would think more elderly patients.
Lots of elderly.
Yeah, lots of elderly, but then, because I guess more chronic diseases.
Like they could work with people with cancer, or if you have some sort of genetic condition that you have all your life, and you've got to learn how to manage with the different stages. And
but then also anyone can get injuries at any age, so then they're needed for all ages, I guess.
Yes, very good. Yeah. And Amita, what kinds of occupations do you enjoy? Or in other words, what do you like to do?
I like running and lifting weights, and doing spin classes, and I like going to Amanda's spin class.
Yes.
And going on walks with my mom. And I love yoga. Yoga's so good. I used to teach yoga in Milledgeville, but I haven't done that for a little while. But I want to get back into it.
Yeah. So if something happened to you, like, I guess a lot of the things you enjoy to do, your leisure occupations is what we would call it, are more active kinds of things.
Right, for sure.
So, like, if your wrist or your shoulder was giving you trouble,
I would come to you.
And we'd help you work through things like if you want to go to the bike class and your wrist, like you couldn't use your wrist as well as normal, then we could help you with that. Or even if, like, for some reason you had such a problem where you couldn't drive, that they could help you get the tools that you need to be able to go places and
very neat.
Be independent.
I'll keep that in mind.
Yes. Yes. And do you have any family members who might be interested or have received occupational therapy services in the past?
My grandmother, has Parkinson's disease, and it's gotten worse and worse over the years. And it was right around the timing that she had surgery for her back that I don't know if it just enhanced the Parkinson's symptoms, but her shaking got really bad with her hands, so she can't do very much. She can't walk very well, because at first it was a stutter as she would walk, but now she just can't really walk very much at all. And she had a physical therapist for a while, and I want to say she did have an occupational therapist too, and they came to her house and worked with her for a while. But I'm not sure if something happened with their insurance or she just didn't want to do it anymore. But I don't think that she sees one anymore, or if she wasn't seeing benefits or what. But
I don't know.
I'm not sure. But she was seeing, for sure, a physical therapist, maybe an occupational therapist.
Yeah.
So
there was mixed research with what I saw from whether OT. I was looking for specifically OT. I didn't really look for PT specifically with Parkinson's disease. And one of the studies didn't show that it was effective for people with Parkinson's disease to receive occupational therapy. And then another one it said the opposite. They said that it was helpful. It was helpful as well for the caregivers.
Yeah, that's probably the toughest too, is that my grandpa has to do all the caregiving, and it is hard because she is so dependent on him for everything. You know, going to the bathroom, like just bathing, brushing, food, everything. Like, she can feed herself, but even for Christmas we actually got her a spoon.
One of the thick
that
ones.
It's like heavier, it's weighted so that it doesn't shake when she's trying to eat. I thought it was pretty cool.
Yeah. I've seen videos of it.
Yeah, it's neat, the things they come up with these days.
Has it helped her?
I'm not sure. Okay. I need to go see her. It's been like 2 weeks, which is bad.
Yeah.
But yeah, I think the thing with a lot of, whether it's PT or OT, after a certain point in the progression of the disease, you know, there's only so much you can do.
Yeah.
And that's what we found, is it's kind of reached a point of, I don't want to say of no return, but if I had to guess, she stopped going or she stopped having them come see her because it was just painful and she wasn't getting much out of it anymore. And it's probably a lot mental too, because if you really want that help, then you can get there, but if you're just miserable and physically not really capable anymore, then it's tough. And I think that's the point she's at.
Gosh, well, I'm sorry to hear that.
Yeah, it's been tough for all of us, but you know, there's always a chance still that, and I'll have to talk to her about maybe getting back into it.
Yeah.
So.
And you can see what things that she enjoys to do, or if there's anything that even like you could do with her, even though she's not doing it, but you get to be there.
Yeah, I feel like she does stay stationary too much. Whenever we go and visit her, my dad, he's a respiratory therapist, but he's just been in hospital settings and seen a lot of like PT, OT sort of stuff. He'll get her standing up, sitting down, just try to move her muscles so she can not totally have everything atrophy.
Yeah.
So.
Gotcha. Wow.
Yeah.
Well, I hope the best for her and for your family and for your grandpa taking care of her.
Me too. You'll have to come visit soon.
That'd be wonderful. She'll be around.
Yes, she will.
When I get certified.
Yes. You will make her all better.
Yeah.
Thank you.
You don't even, I guess paperwork would be helpful, but.
Yes.
Yes. Insurance.
That sounds good.
Yeah. Okay. Awesome. Well, thank you so much, Amita.
You're welcome.
Hope you enjoyed learning about the value of occupation.
Yes, I did. It's a great profession. Yes. I truly believe that.
Yes. Okay. So, well, thank you.
All right. That's a wrap.
That's a wrap.